Jenny will be, oh, okay.
Sorry. That's okay. Thank you.
Jenny will be in a panel presentation during session 1, talking a little bit more about helping people navigate the exchanges. So if you have other questions or want to get a little bit more information, she will be around to do that. As Teresa mentioned, I am Christine Malvin. I'm the program officer for the HealthPath Foundation of Ohio. I am also the point person for the Community Connections Grant Initiative. So if you have any questions, or you need anything, please feel free to give me a call or send me an email. My business card is in your packet, and I'm happy to help with whatever you need. As Jenny mentioned, we want to help you make your data work for you. And we know what's ahead, but how do we know who's affected, where they live, and what other forces are affecting healthcare in those areas? And we have HealthLandscape here with us today. That is an interactive web-based tool that gives you the tools you need to show the need in your community. HealthLandscape allows you to analyze, combine, and display information in ways to promote better understanding of health. And they have a lot of neat layers and tools that you can add on, and you can make some really great dynamic interactive maps. With us here today are Mark Carrozza and Janae Grandmont. Mark is the Director of Health Informatics and really is responsible for the creation of HealthLandscape, as well as OASIS, which is an online data analysis and statistical software tool. And Janae is the Health Informatics Specialist. She acquires, archives, and shares the data that HealthLandscape has. And if you've ever participated in a HealthLandscape webinar or have called their helpline, Janae is the person on the other end of the phone. So you will get to see her live today. So please join me in welcoming Mark and Janae. And if you want to use
I'll stand here and then I'll wander back and forth. We'll be fine. You can sit if you want. You don't have to stand here the whole time.
Great.
You can. Okay, thanks. My name is Mark, and Janae will be joining us here in just a few minutes, and we're going to be talking about discovering and mapping your community needs. I'm going to take a lead from our previous speaker and ask a couple, important questions. How many here are just incredibly cold in this room? Okay. How many of you wish you hadn't worn a short sleeve shirt today? Okay. All right, so what we're going to do is I'm going to talk a little bit about the Health Foundation and HealthLandscape and our philosophy of data, and I think I'm willing to bet, I don't know this, but I'm willing to bet it's a philosophy shared by HealthPath. So who are we? The HealthLandscape LLC is a social enterprise which is part of the Health Foundation of Greater Cincinnati. We've been around since about 2005. I can tell you that with the Health Foundation, with HealthLandscape, and I'm betting HealthPath, the idea of data democratization is very important. The idea of getting community data, getting federal data, getting state data out to the users is incredibly important. My driving reason for existence for the last couple of decades has truly been, how do I get data away from data producers and into the hands of the people who need to make decisions like you all in this room. That's an incredibly important driver for me. So what can data help us do? And I'm going to be very quick through this because I know you want to see some maps, you want to see some demos. We all know that the most compelling thing is to have a story about a person, about a family, about a group, and get that in front of people so that people can relate to that. Once you've seen that story, however, you really need to have data to back it up, okay? And that's where websites like HealthLandscape, like OASIS, some of the others that we're going to show you today really come into play. What else can you use data for? Identifying and documenting needs. It's always important in a grant application. It's always important when you're really trying to document what's going on with the family or with the family stories that you have valid, useful data that really helps cement the story that you've been telling. It's good for developing partnerships, not only to help understand who else are important players in that area, whether you're dealing with health or dealing with education or dealing with crime, but it also helps you understand who can I be working with in this area to try to increase whatever I need to increase or try to decrease whatever it is I'm trying to decrease. Just educating policymakers. There's nothing more important, nothing easier in the world than taking an iPad or Android tablet and pull up a chart while you're sitting in a room and say, look, here's a trend that's going up that we really need to be going down. We saw it on the previous slides. Having data to help justify your argument is important, important, important. I can't stress that enough. Advocacy, same reason. Whenever you're trying to make a point, making the point with data is incredibly important. Grant writing and program evaluation, obviously that's why we're here today, is to talk about the value of data for grant writing. What are the different types of data? Well, everybody knows that data is data is data. Well, that's not always true. There's data about people. There's data about organizations. There's data about communities. And the data that you want to use really depends on the story that you want to tell. So it's always important to think about your data, think about your audience, think about your target message. Data about communities, I think we've talked about that. Raw data versus interactive data. For me, it's always important to get down to the lowest possible data possible. When you're looking at national data sets, you see that you have, I'm making this up, 14% poverty. Well, 14% poverty in the U.S. doesn't really tell me anything when I'm looking at Ohio. That doesn't really tell me anything when I'm looking at the Appalachian counties. That doesn't really tell me when I'm talking about a particular neighborhood within a particular county. So it's always important to try to get the most down to the community level data that's available, and that's what we're going to be talking about today. We're also going to be talking about interactive websites. I always tell the story. Unfortunately, I've been doing this so long that I've seen data go from punch cards to round reel tapes to 30, 40 cartridges to CDs to websites. I got to now cloud computing, which is really just websites. But in all of that, the thing that I started the presentation with still holds. How do I get the data out of the people who create the data, whether it be data nerds, whether it be hospital systems and EMRs, whether it be school districts and the report carding data and student level data? How do we get that out of their hands and into the hands of the people who make decisions? Okay, that's always the key. That's the thing that we always need to be thinking about. So when we're talking about online data, how do we know whether or not that online data is good? Okay, we saw some maps in the presentation, great looking maps, and I'm not picking on you, but you're here. I have no idea if that data is good, okay, other than what I see on the screen or what I pull up on a website. So how do I assess that information? How do I know whether or not that information is useful? Well, the things you need to look at is you need to look at what you think of about the accuracy, the authority, the objectivity, the currency, and the coverage. So let's talk about what those mean. Accuracy. Does the data appear to be reliable and error-free? Okay, if you pull up a website and you see that the poverty rate in Cincinnati, Ohio is 97%, chances are that there's problems with the data. Or there's chances in the way they presented, the problem with the way the data has been presented, or problem with your understanding. Doesn't mean the number is wrong, just means that collectively we need to make sure that everybody understands what that numbers mean. Also, is there an editor or someone who's vetting that data? If it's an automated system, is it something that's been reviewed multiple times so they know the reports are being displayed accurately? Authority. Where did this data come from? Is the web page signed? Is it very obvious that this data came from the Ohio Department of Education, that the data came from the FBI, that the data came from a particular organization? Not that non-governmental agencies don't have good data, but you need to understand where the data came from and why the data exists. And not only why does it exist, but is there something that lets you go back to the beginning of the data? Who created this? Why did they create it? Can you go back to the source provider and say, Mark, you created this data. How did you create it? Why is it there? How accurate can this data possibly be? Objectivity, same thing that we were just talking about. I'll pick on some organizations that are in the news right now. The federal government releases some data. The NRA releases some data. Not that one group or the other has bad data, but you have to ask, why are they presenting a particular data point, and is it telling the story that you think is objective, that you think is valid, that you think is reliable? You always question every piece of information that you see on any website, okay? Even when I show you HealthLandscape here in a few minutes, you always question everything that you see. Currency. We're all guilty of this if we all maintain web-based data systems. The most recent data, if you go to a website like HealthLandscape or Oasis or some of the others that I'll show you, and the most recent data is 2002, chances are someone's not keeping up with their data. Okay, chances are that that's not going to tell the story that you want to tell today because you have no idea what the difference is between 2002 and 2013. Okay, so always just look across the web page. Just because they say poverty is 14%. That was poverty in 2001. Doesn't mean a thing for you today. High school graduation rates in 1995, useful historically, not the most useful thing for us today. Coverage, this is my own pet peeve. Are they really just recycling information that isn't really new, isn't really useful for you? This goes back to the authoritativeness of a web page. We have a lot of census data on our webpage, okay? And I will tell you right up front, we do not collect the census. That is not our data. We get that from somebody else, okay? On our sites, we make it easier to access the data, make it easier to acquire. But again, you always have to think, who is the authoritative source behind this data, and does it make more sense for you to go back to the original data, okay? And we'll talk about that when we talk about a few more examples. This is always my favorite part of the presentation when we're picking out some websites and we're talking about who are the good, who are the bad, and who are the ugly. I'll keep this fairly brief. The good, obviously, Census Bureau, CDC, Bureau of Labor Statistics. These are data sets that you see every day. These are statistics that you see in the newspaper. Most of these you can acquire down to the state and the county and sometimes some county areas. And that's always important for the type of work that you're doing. Doesn't mean that the data are always right, but they're always reliable, okay? And we won't talk about the difference between reliability and validity, but everybody knows poverty is a great number, maybe not the best number for measuring how poor people are, okay? If you're not familiar with that, we can talk about that during one of the breakout sessions. But the nice thing about the federal sites and most of the state sites is the data that you see are the best, most accurate data that you can find, short of going out and spending hundreds of millions of dollars to collect your own data. I see people scratching down websites, and I hugely apologize for not giving you handouts. I will talk to Christine about sending out an email that has a web link where you'll be able to, a reliable web link, where you'll be able to get a copy of this PowerPoint presentation, okay? So scratch them down if you want, but we'll get them back out to you. My apologies for the Cincinnati-centric nature of this next slide. It happened to make it into the stack. In Cincinnati, in that region, if I'm presenting this, things like HealthLandscape, Community Research Collaborative, these are all websites that I've largely been involved with, so I know that they're very good, with the exception of Hamilton County Public Health, and I even did some of that too. So, but I'll show you a couple of these and show you what's good about it, and I'll show you what's bad on my website. I don't have any problem with doing that. Bad websites, I'm not going to pick on anybody in particular, except for the Ohio Department of Education, apparently. And this thing that we talked about before in the evaluation criteria, static sites, sites that you've been to the site 3 years ago and you know that number hasn't changed. You look at the date at the bottom of it because they have a date time stamp. This thing was updated in 2001. I know Mark Croza hasn't worked there in 17 years. Chances are that this data is out of sight. Counterintuitive interfaces. I'm sometimes as guilty as others. People who create websites and who are data nerds have a specific language, and sometimes it's not a language spoken by the rest of you. So a lot of times you'll come to a website and they'll talk about parameterizations of variable distributions, and that will be incredibly boring to some of you. Some of you will get it. So it's really the interface and how intuitive it is, and how soon you can get to that data. Because remember, how do we get from data producers to the data users? The good intuitive sites get you there faster. Poorly managed and update sites, we've talked about before. Always ask, always ask, always ask. This is the most important question you'll ever ask when you look at a website, okay? Why are they making this data available, okay? If you think about the CDC, if you think about the Ohio Department of Education with their non-intuitive site, they do it because they're required to do it. They're going to make the most reliable data available. They're not going to really make judgments. They don't really care in the statistics department what the free lunch program utilization rate is in Cuyahoga County schools. They care that the number is accurate, they may care that it's available, but they're not trying to prove a point by having a number high or low or something like that. So that last question, when you're looking at the data sets, looking at websites, why has this data been made available? That, if you can answer that in a way that satisfies your needs, then you'll be happy. And that's just an ugly picture. So I'm not going to give any ugly websites, but I found that one day, and I've used that on all my good, bad, and uglies, and I won't do that again. That's my only picture for the day. Okay, some local data examples and some national data examples. This one, you don't want to scratch these down, but these are some good sites. Fortunately and unfortunately, in Ohio, the 3Cs are very good at producing data and getting data back out to the community. Not so good in the northeast and northwest and southeast corners. They're getting better. These three organizations, the Facts Matter website, the Central Ohio Data Tools, and the Northeast Ohio Community and Neighborhood Data for Organizing, that says something. I forget exactly what that acronym says, but it says something. Those are three sites that are maintained by credible organizations who are trying to get data back out to the community. And if you're working in that broad swath, going from northeast to southwest, chances are if you go to one of these sites, you can either find the data that you're looking for, or they'll have links to that data. Each of those will have health data, crime data, economic data, social data, pretty much anything that you're looking for. Facts Matter, obviously I'm involved with that one. The bottom two are both maintained also by organizations like the United Way and the Chambers of Commerce and the local community foundations. So again, why are they making the data available? Okay, not because they want to drive you to do something, because they want to drive you to make good decisions. They know that you're coming to them in a lot of cases asking for dollars, for funds to do something. Well, they want you to do something, they want you to do something right. So to answer our question is, why are they making this data available? They are making this available because they want you to make the best decisions, so that you can do something good with their dollars and with the community dollars. Okay, so those three sites I'd go take a look at if you were in any of those broad swaths. If you're not there, or if you're even in those areas, you may still have to go to some other data sources. There was nothing special about this list, except that this is the list of, if someone says, Mark, do we have data on whatever, and if I don't have it, chances are I'm going to land on one of these sites, okay? There's lots of other good sites, but on any given day, week, month, year, chances are, if somebody asks me for something, I'm going to land on one of these websites. www.data.gov, incredibly important site. I would write that one down. If you write nothing else down, www.data.gov. Probably about 4 years ago, the federal government began the Open Government, Open Data Initiative, where they have been really pushing hard to make all data available. Some of the data we're going to show you here in a few minutes from the UDS Mapper site. 4 years ago, the uniform data set data from FQHCs was never seen again once it was sent off to HRSA. Now that data is out available where people can start to look at it and see where are the underserved areas, those sorts of things. Okay, so the feds really are pushing hard, get data out, get data out, get data out to the community. And www.data.gov, best place to go, okay? And that site actually will either has or will direct you to these other sites, Census Bureau, Department of Education, CDC, health indicators. Again, that's a collection of all the health data. A lot of it that goes down to the county level and to the sub-county level. EPA, very interesting data if you're interested in environmental issues. HUDuser.org. Actually, I love that site. They've got a lot of very local data. They've got a lot of it's housing and tangentially related to housing, but it's very good data, and it's usually down to neighborhoods, down to zip codes, down to very small sub-county areas. So if you're marginally related to housing information, I would visit that HUDuser.org site. CountyHealthRankings.org and HealthLandscape.org. County Health Rankings just updated their health-related data where they've aggregated some CDC data and some census other data. Very popular site. And then HealthLandscape.org. Okay, so now we're going to talk about Health Landscape. How are we doing on time? I'm assuming we're good. Okay, 11 minutes left? 25 minutes. Oh, okay, good. Any questions on that prelim stuff? That was sort of a quick run through. All right, so Health Landscape. Again, Health Landscape was created about 2004, 2005, whenever it was that Shiloh gave me a grant while I was still at the university to build Health Landscape. And the idea was to continue the tradition of how do we get data, again, out of the hands of the data producers into the hands of the data users. And how do you visualize data? We've been making maps recently for a local hospital in Cincinnati, and I had a physician say, well, this is great. This is a map of all these patients that have, a high chance of, coming back to the hospital with congestive heart failure. So what? Just send me, just print it out and give me the list of those 37 patients, and I'll go deal with them, okay? the immediate obvious answer was a list of 37 patients is a list of 37 items that you scratch off real quick. A map on the screen is 37 red points where you have to go, what is going on there? Why is there also a cluster here? Why do I also see that these are all around the same healthcare provider? Is there something about that patient or that set of patients that I need to do something besides just go down, call them up, ask them what the weight is, make sure they're not putting salt on their eggs, okay? There's other things going on, and a map helps you discover what that is. HealthLandscape's partnership with the Health Foundation of Greater Cincinnati and the Robert Graham Center. How many of you are familiar with maps? How many of you use Google Maps? How many of you use Google Maps to get here today? Okay. Okay, then you're used to maps. You know what a map is. You know that you've got the earth, and you've got buildings on top of the earth, and you've got roadways on top of there. But there's other things that we know. We know that there are political jurisdictions like counties. We know that there are catchment areas around FQACs. We know that there are school districts, okay? And the idea of how do those overlap, how are different services provided, and sort of a different checkerboard pattern, all of that helps you understand what's going on for a person, for a community, for a metro area. The way to think about this is the old onion skins. Anybody remember back when they used onion skinning to create cartoons, and you could set through a little book and flip through them, and you could see the cartoon characters move? Anybody ever make one of those? See, so you guys get it. You get the idea. So the idea is, again, there's the idea of the communities. There's the base earth and all the different layers that you can stack up and see how do they interact. How does the location of school districts and government policies at the county level and at the state level interact with what's going on in a school district with compared to what's going on with the service area of a United Way and a community foundation? How do those overlap? How do those help solve problems in the community? This is my favorite catchphrase. If a picture is worth 1,000 words, then a map is worth 1,000 pictures. Go back up to this. You have all seen this. This is the coolest part about maps. The difference between this map and a map from 500 years ago is the idea that we now have data that's explicitly attached to a map. We've all seen the map up in the top, maps like that up in the top left-hand corner. You got a metro area, you got highways going in and out, you've got different information. What we can do with the geographic information systems like HealthLandscape is take all the data that we used to see in tabular format. So on the right-hand side, we got this nice little map of, or nice list of, in this zip code, we have this many patients. That's 14% of all of our patients. And the cumulative total across all of these is this. That's a very interesting table, very accurate, incredibly boring, tells me nothing about the distribution of these patients. If you look at the map on the left, you see a zip code level map that shows you where is the concentration of my patients, or the concentration of my students, or the concentration of my whatever that you're looking into. And I'm going to turn this over to Janae for a second, let her talk about these next few slides, because she put these together, and now I'm floundering.
So the reason that we put these couple slides together is just to give you a little bit of background information on what geographic information systems mean and what some of the different keywords that you'll hear when Mark starts talking about HealthLandscape and when I talk to you about UDS Mapper later. So GIS stands for Geographic Information Systems, and in the last couple years it's become a really great and more popular way for organizations and individuals to present data to tell meaningful stories using pictures, which is much nicer than data tables. So when we're talking about geographic data, usually it comes in three forms, which are points, polygons, and lines. And the neat thing about GIS is that it also includes all of the data that are associated with those entities. So the way that the process usually works, if you're sitting in your own office with your own ArcGIS desktop license, is that you would have to go out and collect and compile all of your map layers. So you would have to get all of your census tracts, all of your counties, all of the data that goes along with all of those geographic entities, and then you'd have to build your own database. And that's when you can start using the GIS system to get information about your problem so that you can try to figure out what the mechanism behind that problem is and how you can go about solving it. And the neat thing about HealthLandscape is that it does most of that for you. So Mark will spend more time talking about how that site works and how you can use it to your advantage. But the way that maps work is they're using symbols to convey all of the information, and points are usually differentiated by shapes, colors, and outlines. Polygons you can differentiate using different colors, patterns, and boundaries. And lines are usually things like width and color. And we don't have a lot of line data in HealthLandscape. Things like highways are lines. So here's an example of some points. And this data actually comes from the UDS mapper, so it'll look familiar when I show you the site later. But it used to be that you'd have 3 spreadsheets. The top left-hand corner is all of your hospitals. The top right-hand corner is all of your grantees, health center grantees. And the spreadsheet at the bottom is all of your federally qualified health centers, so the actual service access points for the low-income and uninsured to come in to get access to health care. So what you can do is you can take all of those points that are in address form and you can put them all on your map so that you can see where they're distributed in a geographic manner. So you can see where the hospitals are, where the FQHCs are, and I believe those blue triangles that don't have a spreadsheet are FQHC lookalikes. So then you can also do the same thing with polygon data. So what we have here is a spreadsheet that shows you the ZICTA, which is short for zip code tabulation area. It's more stable than zip codes, so a lot of the federal data is presented at that level instead. And it shows you what the percent of the population is that's currently unserved by any federally qualified health center. So the darker areas represent areas that have higher percentages of patients who don't have access to health care, and the lighter areas represent areas that are currently being served. And then you can put both of those things together. So now we have a map that's showing us where the distribution of the health centers are in relationship to the population that don't have access to that information. So that's our really quick and dirty 2-minute introduction to GIS, and I'm going to give it, do UDS first? Okay, so we'll do UDS first. And then I'll give it back to Mark, and he'll show you HealthLandscape, which is, I'm not sure what to do here. Hold on. I'm hitting escape. Thank you. I need internet. Okay. All right, so as Mark started telling you about earlier, the UDS stands for Uniform Data System, which is a collection of federal data that all of the federally qualified health centers are required to report every year. And as he mentioned, it used to be that all of this data was reported every year and then stored in somebody's database without ever really being seen by anybody who might be able to use it for good works. So let me try to log into this real quick. And when this was originally launched in June of 2010, and we update it every year when we get new UDS data. It usually takes place during the summer. So at the end of this summer, you're going to see brand new UDS data, and it's also going to look very different because it's actually going to be a part of HealthLandscape, but I'll let Mark talk to you about that. So what we have is a map of the entire country, and it's all based on ZICTA level data. Oops, pretend we didn't see that. Sorry, I can't see anything or get anything to work. But we'll zoom in, and I'm going to continue the Cincinnati-centric trend just because that's where I happen to be, and zoom into the Hamilton County, Cincinnati area so that I can start telling you about all of the neat UDS data that we have in here and how you can use it to your advantage. And I can't find my own county, apparently. So let's find county. I think the counties are broken. And apparently I broke the website this morning. I apologize.
So remember, how do you assess the website? It's a real life. It's all part of the evaluation plan.
Well, this is nice. It was working fine 20 minutes or an hour ago when I came up here and logged in to begin with. There we go. All right. Here's some names and labels. So hopefully this part of the country looks somewhat familiar. We'll just go back over here to Hamilton County. So for those of you who are interested in access to health care, which it sounds like most of you are, UDS is probably a really valuable site for you. Right now, it's built on federally qualified health center data, but in the new edition that's coming this summer, it's also going to include data from all of the federally qualified health center lookalikes. So you're going to have access to more information about, in addition to who's not being served by FQHCs, who's also not being served by their lookalike organizations. So originally, the UDS mapper was built so that organizations who wanted to increase their capacity could come in here and look at the population centers, look at where people still needed access to health care, and then submit grant applications to build new sites or to increase the capacity of their existing sites. So what we've done is we've come up with a list of layers that they wanted to include that they thought would be helpful, including things like grantee penetration of the low-income population, and that's this one that you're seeing right now. On the bottom left-hand corner, you'll see the legend that shows you what each of the different color gradations represent. So the areas with darker colored green are areas where there are more low-income population that's being served by the grantees. So you can also come in and you can start looking at where your access points are. So you can add the service access points, the health center lookalikes, the rural health clinics, the hospitals, and get a better idea of exactly what's going on in your community and exactly who is available to serve the needs of your population. Just wait for it to catch up with me. So let's say that you're interested in serving the western side of Cincinnati, which only has 1 or 2 health clinics up there, and you want to submit that your grant application needs a summary of what that population looks like. What you can do in addition to having this nice pretty picture of the map that's showing you where all these people are unserved is you can select all of the ZICTAs that you plan to serve, and you can go to the ZICTA data table and get a nice summary table that's telling you all of the information about that ZICTA. So here we can see that in these ZICTAs that I've selected, there are 76,000 total individuals in that ZICTA, 14,000 of whom are considered low-income population, and there are a total of 12,208 patients that are currently being unserved by the federally qualified health centers, or HCP grantees, as their name just switched a couple months ago. So all of this text is different, but my brain hasn't caught up with that yet. So you can export this to submit with your grant application so that you can understand exactly how adding an additional health center or increasing the capacity to add new physicians at this health center up here might help to increase the number of low-income population that are being unserved. We've also included information about the dominant grantees. So if you wanted to look and see where, which grantees are serving which segments of your area, you can see it's colored by grantee. So the darker purples down here are all being served by, it looks like, neighborhood healthcare is the dominant grantee over here. So you can see where there's overlap in service areas. You can look at the grantee penetration of the total population rather than just the low income. You can flip it around and look at the percent of low income that's not served, which is the purple one I was showing you earlier. And then we've also got information about how many grantees are serving each ZICTA. So where the darker colors are the areas where you'll see that there are more grantees that are serving those areas of population. So down here in Cincinnati, there's a larger concentration of points representing the grantees, and you can see the darker color orange down there. And I want to leave enough time for Mark to tell you about HealthLandscape, because eventually all of this is going to interact, and you can put all of your data in here as well. And you probably need a good 10 minutes to do that, so we'll trade.
Okay, probably about 2/3 of you are sitting here thinking, well, you know what, I don't work at an FQAC. I don't really care about what's going on. I care about what's going on with FQACs, but it's not a driver for me right now. But a lot of us are interested in other population characteristics. Where are the uninsured? What's the total population? What's the race distribution, the Hispanic population? Where's that at? And all of that information on this particular site is already there, and it's available to you down to the ZICTA level. So even if you're not doing work for FQACs and you want to know, where is the uninsured population, how many of the uninsured are not being served for some other entirely different reason, all of that's available to you here. It's available, actually, if you wanted to go through, there's a couple of links up at the top where you can actually download all of the data for an entire state. So you can have zip code level, ZICTA level data on all this information for the entire state of Ohio, if that would serve your purposes for whatever grant or whatever documents you're putting together. Okay, so now we're going to jump over and just do a real quick demo of some things in HealthLandscape. Typically, probably in about 3 weeks, we're doing another training session on HealthLandscape, usually about 4 hours, and you're going to get it in about 7 minutes. So try to keep up. Sorry. Okay, so HealthLandscape. Yes. Yes. Can I say that? Yes. Yeah. So the Health Foundation produces this. HealthLandscape LLC is a social enterprise. I didn't come here to sell, but yes, we do things. If you want a specific web-based tool built. If you want someone to do specific analysis for you, then we have a team of people at HealthLandscape LLC that can do that work very, very easily. So yes, absolutely. And I'll get you our contact information, I think, at the end of the slides. Okay, people come to HealthLandscape and they ask you, Mark, why didn't you sign in correctly? I really do know my own username and password.
Can you talk about it, and I'll try to log in as me.
Okay. Hi, I'm Mark Cruz. I'm with HealthLandscape. Okay, while we get logged in here, again, the idea of HealthLandscape is to get health data out to the community. We've included health data, crime data, economic data.
We were all just signed in like an hour.
Apologies, it's thrown us for a loop. So I'm going to show you a couple real quick tools. I'm going to show you our library of data sets that we call Community Health View, and that does have all the different data that we've been gathering for the last very nearly a decade now. I'm also going to show you a very couple real quick tools where you can take your own data. So let's suppose you're working at a hospital or a health center or a school district or whatever, and you've got data that's been aggregated to zip codes or to counties or some other geographic area. You can take that information and move it into HealthLandscape and show it with all of the other data that we have in HealthLandscape. Okay, just very quickly, I'm going to jump in and show you a nice tool that we have called Quick Maps. And the idea of Quick Maps is really just that. How can I very quickly make a map of the dependency ratio? The dependency ratio is the proportion of the population below 15 and above 65, that population that is dependent upon the working ages. And we see that for the United States. We see it for the state of we see it by state, and as we zoom in, we very quickly see that data switching from state-level views to county-level views, and as we zoom in even closer, it'll switch from county-level views to census tract view. Very cool data, okay? We have this information for lots of different indicators here from the American Community Survey, which happens every year from the federal government. Downside of this is that it's a very dumb map. In other words, it's a nice picture. It's very useful for background information, but there's no data behind it. Where are the data? I can't put my mouse over top of this area and see what that is. I see a legend down the bottom, but it's nice background information, but I need my maps to be just a little bit smarter. So I'm going to zoom back out here to the US, and I'm going to go over here to another tool that we have called Community Health View. Community Health View allows me to come in, type a particular topic. So let's say I'm doing work on vegetables. Well, as soon as I start typing in vegetables, it narrows this big long list of data down to those few things that talk about vegetables. And it looks like we've got the USDA Food Atlas data. And again, that data is available from the CDC. That data came from the federal sources. You could absolutely go there and download that data, but here the data is downloadable and it's also in a mappable form for you to make an attractive report, attractive map for your report. So we'll go ahead and we'll select the USDA Food Atlas. Once we've done that, it gives us the option of selecting what it is that we would like to map. So we're going to map percent of farms with direct sales. I know it's not vegetables, but we're going to do percent of farms with direct sales. And boom, there's our map of the United States by county. We'll zoom in here to Ohio, to Northwest Ohio. And now when we put our mouse over top of each one of these counties, we start to see that up here in Sandusky County, up in Ottawa County, up in Lucas County, we see 14.5% of the farms have direct sales. And we could also go in and add all the other information that's available in this data set to that little tooltip. So now when we move our mouse over, we see a lot of very detailed information for Lucas County. We see the percent sales, we see the dollar amount of direct sales. So we have all this data available for lots of different topics. Chances are we've got the data. I won't say that enough that over the last decade, we've always had, at least since 2008, an FTE in the office whose sole purpose is to go out and acquire data. okay? So we have thousands and thousands of data elements available for you in HealthLandscape. Now, the question still becomes, all right, that's great. That's cool that you've got all that data. It's federal data, but I've got my own data. I know that I can go into my EMR, I can go into my student registration database, or I can go into my donor database, and I can get that information, and I can get how many do I have in each zip code. If I have that, how can I make a map of that? Well, I'm going to show you. This isn't exactly zip code level data, but it is county level data, and it'll give you the same feel for how simple it is to use. So here the data is. Here are the data for county level poverty for Ohio, Kentucky, and Indiana. I won't go into the details of the data. Just let you know that I've got an indicator in there that tells me what data it, what county it is. I know what the population, percent of the population in poverty is, and I know median household income. This is just a straightforward spreadsheet. I've got it on my desktop. It's one of my data files that I've got, or I've had someone generate for me. Now I want to make a map out of it. Well, if I can highlight it and copy it, then I can go back to HealthLandscape, use a nice little tool that they've got there in HealthLandscape called Quick Themes for thematic mapping. The Quick Themes tool will allow me to paste it in. Okay, so I've just taken it out of my spreadsheet, dropped it down into HealthLandscape, tell it that it's county level data, tell it a couple other things. That's part of the 4-hour training. But really, I mean, it's not because there's lots of other things. But this part, I mean, you see, copy, paste, make a couple selections. Percent under 18 who are in poverty. Load the map. And there's your map of poverty by county. That could be zip codes, that could be census tracts, that could be anything. So if you can aggregate the data to that level, it's very straightforward to do that. And what's nice about this is now you can go back in and add other pieces of information. So where are our hospitals? Where are our FQHCs? Where are our SAMHSA facilities? Take all the data that's out of the community health view, all that other big pool of data that we've got sitting there, and add that to the system, okay? I've got negative minutes left, so I'm going to show you one more thing.
Mark, is your training available via webinars?
We have webinars. We also have any number of YouTube videos to show you how to do this, and we do different webinars around the state, or presentations sometimes around the state. If you're generally in the southwest area and you can get to Cincinnati, like I said, like 3 weeks, we're doing a big all-day workshop on how to do this. Just very quickly, maybe not. I'm sorry. I'm taking up your break time, but is that it? Okay. Okay, so again, let's suppose you don't have aggregate data, but you actually have individual addresses. Like here's where my students live. Here's where my recidivists live, okay? All this information. I've got a street address. I know whether or not they are this, that, or the other category. In this case, this is from Hamilton County, Ohio, 2005 death certificates for the infant mortalities in Hamilton County, Ohio. It's very simple for me to go in, take my spreadsheet of data, same rules, copy it, go to HealthLandscape, use our quick geocodes tool, paste it in place, tell it where the address is, and categorize it by whether or not it was a low birth weight death. And as soon as you do that, it starts adding it to the map, so you have points on the map showing where each of those deaths occurred and whether or not it was a low birth weight death. Okay, a lot of information there. But again, the idea, now we can go back to our quick maps, or for example, our ACS quick maps, and look at the poverty population. Percent of persons under 18 who are below poverty. Add that to the map. And now we can start to directly compare where are our infant mortality compared to areas of high poverty, down to the street level if you really wanted to get that low. Question?
Can you show something like health professional shortage areas or?
Certainly. Sure. So we'll take away our poverty data. We'll leave our geocodes in there so we know where infant deaths are. And we have that as a simple base map where we can go in, where are our HIPSAs, where are our medically underserved areas. Do we have any HIPSAs in Cincinnati? Do I just not see it? May have to zoom out, and I may have to, yeah, they're there in the bottom. Let's get rid of all those streets. The streets are distracting. We'll go to a gray background. And now we can start to see where are our points compared to the HIPSAs, health profession shortage areas in Cincinnati, Claremont County, that area. All part of, so all these different types, all those different types of layers, health profession shortage areas, lookalikes, FQHCs, shortage areas. If you're familiar with the Dartmouth Atlas, the hospital referral regions, that data is all here. Thank you. 3 minutes late, sorry. Thank you.
I know that was really quick and a lot of information, but Mark and Janae will be available in Salon 1 during session 1, breakout session 1, to answer your questions. We'll have a couple laptops available too if you want to actually play with the maps and get some information. And we will also post Mark's slides and provide their contact information both on the website and in an email to you guys after today. So you will have a chance to contact them. We are going to take about a 10-minute break. I know data sometimes makes people a little bogged down and tired. So we're going to take about a 10-minute break, stretch, refill your beverages, and be back here about, maybe about an 8-minute break, about 11:35.